Clinical psychologists refer to patients as clients. They meet with clients to identify problems such as emotional, mental, and behavioral issues in their lives. Through observation, interviews, and tests, the psychologist will diagnose any existing or potential disorders.
Clinical psychologists do not prescribe drugs, but most will have a good understanding of medicines. Unlike psychiatrists, they can prescribe drugs as they studied medicine first, then gone on to a further 4 years of study and work with mental illness. A clinical psychologist provides counseling and psychotherapy, but will also draw from rigorous scientific research to ensure that treatments are effective and well matched to what the client wants, whereas psychiatrists will sometimes use medication to help in treatment. Clinical psychologists will often be more active than psychotherapists and counselors.
The research helps us understand behavior, memory, and mental health disorders. Through counseling and experimentation, psychologists work to promote safety, understanding, and good mental health. They can be found in practically any work environment, including hospitals, schools, and corporations.
First of all, everyone has to know that all suicidal thoughts and behaviors should be taken seriously. Psychologists can't prevent all suicides, but it can be prevented and lessened. Suicidal thoughts have a lot of causes, possibly from a family history of mental illness or challenging life events like a failed relationship, rejection, and abuse in the form of sexual, emotional, or physical. In terms of treatment, there's none that specifically stops suicidal thoughts, but there are several ways of psychotherapy and antidepressants that have been able to be a factor in treating patients. When a patient is in crisis, immediate hospitalization should be done to prevent suicidal action.
Clinical psychologists need certain personal characteristics to provide the most effective and helpful service, like empathy, being non-judgmental, confident, patient, and have excellent communication skills.
Clinical psychologists must have an outstanding communication skills, reporting skills, and interpersonal skills. They should demonstrate self-awareness, objectivity, a strong desire to help others, and treatment options available to patients. Most especially, a clinical psychologist requires to have a license to be able to practice. Technically saying, everyone can avail such services from a clinical psychologist, but no one should abuse it, since there are people who really need their help. As a role of a clinical psychologist is to meet with clients and to identify problems such as emotional, mental, behavioral problems of their lives.
Schizophrenia is a serious disorder which affects how a person thinks, feels, and acts.
Someone with schizophrenia may have difficulty distinguishing between what is real and what is imaginary, and may have difficulty expressing normal emotions in social situations. Schizophrenia is a chronic condition requiring lifelong treatment.
Gising. Slowly, kunwari, suspicious. Gusto mo kung lumikot, ganun. Takbo! Mas panic kayo dalawa, ano po? Tatlo pa. Pinapatawa niya si Darwin. Tapos iwanan one talk niya na. Darwin, magising ka na.
Yan na. Watermelon.
Pwede.
Pag-ikot.